Yes,
So
sir.
welcome to BW Healthcare World. Uh, Today is a very unique conversation that we are doing. We are faced with a lot of legal issues around us, but we forget that when we look at healthcare as an industry, one of the most important role is played by the doctor. To understand what are the legalities that the medical professionals need to be mindful of, we are starting this series of conversations around what medical legal means. And in the first of this series, the conversation is around the issue of privileging. What does privilege mean? What does it, what is it that the doctor is permitted to do and what he must not do? To have this conversation, we have with us Advocate Shri Mahendra Kumar Bajpai, who's the Advocate Supreme Court of India and is also the Honorary Director of the Institute of Medicine and Law. And to steer the conversation is Dr. Vijay Agarwal, who's the President of CAHO. Welcome, Mr. Bajpai and Dr. Agarwal. Dr. Agarwal, I would invite you to steer this conversation because you are more involved being a medical professional yourself, having run hospitals and administratively managing hospitals. What does privileging mean? And if you can just explain to us and then steer this conversation around the topic today.
Okay. So thank you, Harbinder. And it's indeed a proud privilege to be a part of this inaugural session on this medical legal issues for healthcare. So this first issue on privileging, let's understand privileging is a term that is now used and we are starting to use, especially I would say in corporate hospitals or tertiary care hospitals, to go through the training and the experience of an individual doctor and then to determine what is he allowed to do and what is he not allowed to do. That's a terminology. That is how we are kind of using it. But we must understand that vast majority of the hospitals do not do this process of so-called privileging, and vast majority of the healthcare providers are outside even this realm of the tertiary care where, so one can understand this privileging when, see what is happening nowadays, new and new technologies come. So for example, somebody who's starting to do the robotic surgery in urology will require a very special training, and therefore a issue of privileging will come, whether even though you may have been qualified, are you allowed to do a robotic surgery under supervision or independently? All those things, issues become a part of the privileging. But my question to Bajpai Saab is that we produce more than 1 lakh MBBS doctors. And what we are trying to see is that whenever an MBBS doctor is doing some healthcare service provision, he has done something, whether he has done a debridement of a wound or some complication happens, then I think courts have held that kind of thing against that doctor has been found negligent as if he has not been trained. So I want to understand that in the eyes of the law, what are the kind of things that an MBBS doctor can do or cannot do? Has there been a viewpoint from the legal point of view? So over to you, Bajpai ji.
Thank you, Agarwal sir. Medical practice today is a well-defined profession, especially the ones who practice modern medicine. And the first criteria happens to be qualification. So you have to be qualified, whatever the law of the land prescribes. But in medicine, what we see, unlike other professions, even my profession as a lawyer, I can practice income tax, I can practice sales tax, I can practice criminal law. Unlike Western countries, we don't have a specialization here. But in medicine, even after doing a qualification, there are so many specializations and super specializations that whether you can do X or whether you cannot do X will not remain only, means the only criteria applicable to this will not be only your qualification, something more than that. As you have rightly put, privileging. So in a number of cases, what happens is, I'm talking about court cases where the patients are suing doctors for negligence, deficiency of service, for misconduct. In a number of cases, the courts ultimately come to a conclusion that, look, what you have done, this was outside your purview. Medical science itself is a very complex subject, Dr. Agarwal. You will be the right man to understand that. Okay. So in most of the cases, the courts do hold that you have gone outside the purview, outside your privileging, and whatever you have done, you are not permitted to do, hence you are negligent. But there are some interesting cases where the courts have held otherwise. I'll give a few examples of a few cases decided by the courts in India. In one case, the court is saying that a surgeon can perform a delivery. And the reason, and this is no ordinary court, it's the National Consumer Commission. We all know that deliveries are performed by obstetricians, gynecologists. But here was a surgeon who performs a delivery. And the court is saying that, for deliveries, you don't need extraordinary expertise. So it's good. We do accept that. Another case from Chhattisgarh. A surgeon performs hysterectomy. And the court says, fair enough, you can perform an hysterectomy. Another case where hysterectomy is performed by a surgeon, the National Consumer Commission says, we understand. You are working in a taluka place. There is something known as locality rule in law. Depending upon where you are practicing, what type of facilities you have, we do understand that hysterectomy should be performed by an obstetrician, but here you have done nothing wrong. We go ahead. In another case, Kerala High Court, it's a constitutional court. It is saying that a MBBS doctor who has done 1 year senior house residency in anesthesia can give anesthesia. So there are, the general line is whatever you are qualified to do, you can do. But there are exceptions in law where law has carved out proper exceptions in ABC, either because of your experience or because of the situation where a doctor is working, peculiar situations, we are permitting you. So there is no hard and fast rule. And that is why probably in a number of cases, the courts are asking the regulator. One recent case where the National Consumer Commission has said that scans which are performed on pregnant women, the court has said the obstetricians cannot perform these scans. And today we see every obstetrician has a USG machine and they perform a basic scan. The National Consumer Commission, in fact, has gone to the extent of advising the National Medical Commission, which happens to be a regulator, that you please bring out some regulation, give us some guidelines, whether an obstetrician can do something like this or not. So there are specific areas like USG scans being performed by obstetricians, local anesthesia, especially being given by doctors. Spine happens to be one place where orthopedicians and neurosurgeons, they always have that debate, who can do surgery. So at least on these things, the regulator, the National Medical Commission, which happens to be the body regulating doctors practicing modern medicine, ought to be coming out with some guidelines. But I do agree with you that this issue happens to be contentious.
What I'm saying is that sometimes we are getting clouded because of this era of specialization, so that we are not understanding certain, for example, delivery, as I think the court rightly said, it's not even because he's a surgeon. I am saying that delivery, which was conducted by the auxiliary nurse midwives and all that. Today, if you have not trained your MBBS doctor to conduct a delivery, you see, the role of an obstetrician is not merely for conducting deliveries or cesarean section. There is a lot more things, and in that specialization keeps growing into more complex kind of issues. But certain basic things. So, for example, there was another case where a MBBS doctor who is also a diploma in anesthesia and has gone ahead and done a debridement on a diabetic patient. To my mind, that is something which should have definitely fallen under the category that an MBBS doctor should be able to do that. You don't require a super specialization surgeon to do that work, because we have to understand that vast majority of my country does not have access to specialists and super specialists. We are totally deviating from this thing, and therefore somewhere along the line we must try to find out what an MBBS doctor can do or he cannot do. So
I totally agree, Dr. Agarwal, with what you are saying. But, sir, please understand that the courts are handicapped in this matter. On matters which fall purely in the domain of medicine, courts ultimately look upon doctors only. We call doctors in court as medical experts. We go through the medical text, and whatever we understand, we come out with it. Much more than that, the social angle that you have given obviously needs to be looked into. I do agree with that.
So I feel, Bajpayee, that I think we should take up this case. Actually, National Medical Commission should come out at least with that every person who is being trained, they have the syllabus, they have created this thing. They must say that every MBBS doctor is at least capable of doing these things, because you are giving me a degree of Bachelor of Medicine and Bachelor of Surgery. And after that, all right, you can say, if I have done my house job, what kind of a power do I have more than a person who has just done an MBBS? During MBBS also, I go through an internship. But I feel that the National Medical Council should, because otherwise, I am also raising another point that when you say that you have now the doctor and community ratio of almost 1 per 1,000, which is the WHO's requirement, we may be slightly short or same, something like that, because we don't have the exact data. But half of these doctors, if there are only MBBS doctors, half of them are only preparing for post-graduation, they are not available. Those who are available and are working in the society, and if they are not capable of, and you are not allowing them to do anything, then I think the ratio that we have in the community of the doctors versus community is going to be abysmally low. So it is high time that the National Medical Council has to see that the doctors are job ready and define, because this privileging in vast majority of cases has to be provided by National Medical Council or the medical college which has produced this doctor, that yes, we certify that you are this and now you are capable of doing this in obstetrics, this is what you can do in medicine. If I cannot treat a patient of diabetes or its complications, I don't think this is going to be a right thing in this country.
Agarwal sir, you have also raised a very important point where I would need some clarification from you also. Unfortunately, what we are doing here is that we are reading books. Most of the books which doctors read come from the Western world. Okay. The criteria which are applicable in Western worlds cannot be replicated in India. We need to know that. Unfortunately, what is happening is in court is that we put Harrison before the court. Okay, in US, in the Western world, yes, every delivery has to be done by an obstetrician. That may be their privilege. But as you have rightly put, India not only has an abysmally low doctor-patient ratio, India also 60% of our populace resides in small towns and villages. So if we keep on following those standards, where are we going to take healthcare? So that is very important. So the regulator certainly needs to come out with proper guidance, keeping in mind that they are bringing out the regulation for India and not for some other developed country.
I agree with you. And I think the takeaway today from this conversation that I am seeing is that we need to communicate to the National Medical Commission for a little more aggressive approach towards solving some of these problems, and they should not be sitting on the hedge. I don't know whether that nudge needs to come ultimately even from the court. Court has already, for example, in one case in relation to the ultrasound scan, they have nudged. But I think you require a lot more general nudge in terms of, first of all, how should I look at an MBBS doctor? How should I look at his capability? What are his privileges to provide healthcare in this country?
And Dr. Agarwal, I have one more question before, in fact, which is for both of you. I mean, when we look at the dental surgeons today, for example, there are a lot of these aesthetic treatments that have come out, and where the dentist or such kind of medical specialists are permitted to do these treatments like Botox, etc. Now, who defines what can be done by them and cannot be done by them? Because there seems to be a tiff between the technology provider, their lobby, and the industry associations. The dermatologists say that dentist is not permitted to do this. Dental surgeons say that we are trained for doing much more. Who defines what can be done and what must not be done?
Yeah. So what you are now trying to say is definitely a turf war, basically a commercial angle to this entire debate. And obviously, for example, if you're operating on a spine, so there are neurosurgeons who are operating and there are spine surgeons who are operating, and both will. And in my practice, I have seen either side being excellent result providers and excellent surgeons with the spine background as well as with the neurosurgery background. And either side providing hopeless kind of a outcome on either side. So there is the important thing is also for these people to understand that there, at least in our country, there is a huge scope for a lot more people to join and provide care. Now, what is happening is that all this fight is happening in the big metro towns, where the number of doctors are way beyond 1 per 1,000. We may even be 5 per 1,000, and in Bihar, I may be 1 per 20,000 and 50,000. So the angle that you are bringing, that we don't even have data district-wise or city-wise of the number of doctors, specialists, nurses, so that some kind of a planning, etc., can be done. And therefore, I would say unreasonable competition is becoming the source. Greed is becoming also a source of this kind of a debate. But you are right, somewhere an experience, for example, I'll tell you, I have known of MBBS doctors almost more than 25, 30 years back. So the two brothers, in fact, then MBBS doctors from one of the towns in Himachal Pradesh, I was instrumental in getting them trained, one by an ultrasonologist, another by a gastroenterologist, and they started becoming, and they are like a accepted gastroenterologist and an ultrasonologist in that town, or only MBBS doctor with training. So therefore, even an MBBS doctor undertaking a specific training, for example, for Botox or something, and one has to define the route of that kind of a training, I'm sure can, but I'm saying, so you are at the moment touching the issue of the tie and the bow, while I think our underpants is not in order.
No, Advocate Bajpai, you have something to say.
Harbinder, may I add something to what you have said?
Absolutely, sir.
Okay, one small piece of information. Aesthetic treatment or aesthetic surgery is not a specialization in India. Okay, so every Tom, Dick, and Harry is an aesthetic surgeon, an aesthetic doctor. So it's not only MBBS, it is not only dermatologist, it is BHMS, BAMS, and even quacks, and even certain salons who are doing aesthetic surgery and treatments. Okay, so but this happens to be a big cause of concern. The policymakers need to look into it.
Right. So, with that, Dr. Agarwal and Advocate Bajpai, I'd like to bring this conversation to an end because, I think we have touched upon a very, very important aspect because, like you just said, that, we can't just look at the world and what they are doing and start doing the same thing in India because the situation is very, very different. The number of doctors that we have versus the population is very different. But apart from that, there's an unequal distribution of medical services and medical practitioners in our country. So we have to look at a very different purview of how medical services can be provided so that people who are living in villages and rural part of our country are not deprived of the basic healthcare that should be, be brought to them. The second aspect that, which is very, very important, which I could identify from this is that the need for legality or legal views is more as a reaction to something that happens. When there is a case of negligence or, is filed, that is when we start looking at the legal views. Whereas the education in terms of what the medical practitioner can do or cannot do must be articulated in the beginning so that we can avoid such kind of legal issues. With that, I'd like to bring this conversation to an end. I really thank you, Dr. Vijay Agarwal, for initiating this, this series, and Advocate Bajpai for taking out time to talk on this, something which is very, very serious, and also bring out both the perspectives. So it's not only the negative part of it. You've also shared with us the cases in terms of the court, where they have upheld that the doctor, what he did was the right thing to do. And thank you so much for this very balanced conversation.
Thank you. Thank you so much.
Thank you.
Thank you, sir.